Good morning, everyone. Welcome to an episode of Coffee Break with Card, La Hora del Cafecito sister show. My name is Olivia McDonald, and I would like to welcome you to our show. Coffee Break with Card is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. So come on in, join us at our virtual table, sign in the comment section below, and let us know if you're having a cup of coffee or tea with us. So in today's program, we have the pleasure of interviewing Dr. Megan DeLeon Miller, BCBA-D, founder of the hashtag Do Better Professional Development Movement, which aims to improve access to training and best practices in the field of behavior analysis. She will be discussing with us what families should look for when searching for an ABA provider, what questions to ask, and what are some potential red flags. So join us since we have a lot to talk about. But let's start off by introducing you first to our coffee break hostesses for today. So as I mentioned, my name is Olivia McDonald. I am a public health professional and a card consultant assigned to the early childhood team. I will soon be the mother of two. We have 5 weeks and we're counting down. And I also have a younger brother diagnosed with autism. I'm joined by my colleague, Yasmin Castellano. Buenos dias, Yasmin.
Buenos dias, Olivia. Good morning, Dr. Miller. And good morning to everyone.
So as you know, Yasmin Castellano is an excellent professional in the field of mental health. She's a card consultant assigned to the youth group from middle school to young adults and is a mother of 3, one of whom is diagnosed with autism. Welcome, Yasmin.
Thank you, Olivia.
Lourdes unfortunately couldn't be with us this morning, but she will be back for our next episode. So I'm sure you're looking around somewhere, Lourdes, so good morning to you too. So before we get started, we do want to review the rules we want to adhere to during this program to ensure a safe environment for us all. So please remember to keep an open mind and a positive attitude and to use respectful language in the comment section. And for those of you who are just joining us, I did want to say in today's program, we have the pleasure of interviewing Dr. Megan DeLeon Miller, BCBA-D, founder of the hashtag Do Better Professional Development Movement, which aims to improve access to training and best practices in the field of behavioral analysis. And she'll be discussing with us today what families should look for when searching for an ABA provider, what questions to ask, and what are some potential red flags. I'm also going to check really quick. I just realized I forgot to check to say just good morning to any of our audience. Oh, so say good morning to Chris, Mark, our number one fan, Philomena. That's my mom. And to our colleague, Ema. Good morning, guys.
Good morning.
So before I ask my first question, I also did want to clarify some acronyms for our audience, especially for those of you who missed our last episode on ABA. So ABA, again, stands for Applied Behavioral Analysis. A BCBA is a board-certified behavioral analyst. And a RBT is a registered behavioral technician. So that's pretty much the main terms. I feel like we'll explain everything very simply, but that's those are the most common ones we'll be using. So good morning, Megan. Thank you for being here. I'm so excited that our audience has a chance to hear from you. Can you tell us a little bit about yourself?
Good morning, and thank you for having me, Olivia and Yasmin. My name is Dr. Megan DeLeon Miller. I am a doctoral level board certified behavior analyst. It just means I have my doctorate. So I've been working in various settings and positions to support the autistic community since 2003. I originally started in the field with an internship during my undergrad in Ohio. And I worked in home providing one-on-one services with families in Columbus before going to get my master's degree at Florida State University. Then I went back to Ohio and obtained my PhD at the Ohio State University. My focus has always been on how to best honor and affirm the autistic experience. And I'm continuously learning how to adjust our behavior analytic practices to support the preferences of the populations we serve.
And Dr. Miller, are there basic qualifications a good ABA provider should have?
I feel like we could spend the whole time talking about this one. It's a little bit of a tricky question because there's the on paper answer and then all the other things. So on paper, an ABA provider should have training in behavior analysis. And that's usually identified based on having obtained a master's in behavior analysis or a similar field like psychology or education. And then obtaining a certification such as board certified behavior analyst. There are similar certifications, but BCBA is the most popular. That's the minimum requirement for practicing in the field. And in some places, there are no regulations that govern who can practice. Florida is one of those states. So insurance companies might mandate certain requirements for qualifying. Like they will only pay a BCBA or a psychologist who can demonstrate training in behavior analysis. But in the state of Florida, there are no licensure laws governing behavior analysis. So I typically tell families to look for providers who have obtained training specific to autism in addition to their graduate coursework so that they have experience. If their child's autistic, they want someone with experience with autism, not just behavior analytic experience.
Agreed.
And what questions would you recommend a family ask to assess, BCBA's approach to ABA?
I have quite a few. I picked some of them to talk about for today. So I would definitely encourage families to ask the BCBA about their supervision experience and the types of clients they've served. Some BCBAs have very limited exposure to certain settings or types of clients. They may have only worked in a school or only worked in a home, and now they're working in a different setting, or they may have only worked with younger children and now they're working with older children. So it's really helpful to know what their range of experience is so that you can see if they're a good match for you and your child. I also tell families to ask the BCBA what approach they use for delivering services, just a very broad question. The best answer we want to see for that question is that the BCBA says they take an individualized approach based on the unique needs of the child. Usually we want a heavier focus on it being play-based and naturalistic, but some children benefit more from a structured and more just what we call discrete trial where they're sitting at a table and specific questions are asked in a very structured format, because some children learn better that way. So the BCBA needs to be flexible and individualizing based on the child. And then I have two more. I would also ask the BCBA what their approach to promoting engagement with the intervention consists of, and explicitly ask them whether or not they use escape extinction. It's okay if you all are listening right now and you don't know what escape extinction is. Even if you don't understand that term, ask the BCBA. And if they say they rely on escape extinction to teach the child to follow demands, or they provide any type of answer that implies a big part of the intervention is seeing behavior get worse before it gets better, I would not recommend seeking services from that particular BCBA. There's times where we might need to navigate a little bit more of a difficult situation for the client, but we should be doing a cost-benefit analysis and really focusing on positive approaches, comprehensively addressing any skill deficits, especially relating to emotional regulation. And all of that should be happening before any drastic changes would occur to the child's life that would potentially increase challenging behavior. Unfortunately, some BCBAs don't take a comprehensive approach and they just start using extinction right away. And then it's a lot more difficult and traumatic for the child and the family. And then lastly, I would want to know how the BCBA involves the family within the service delivery. Services are most effective when the family is an active participant. And this means the BCBA and family work together as a team to develop the treatment plans that are feasible for the family and aligned with the values of the client and the family. If the BCBA indicates that they're going to do all of the work, that the parents are not expected to be involved, or even worse, they say the parents are not allowed to be involved or be observed, then I would seek services from a different BCBA.
Totally agreed. And in the Spanish, I was saying that not only for to be involved in the treatment plan, not only for ABA therapy, but any type of therapy, speech, OT, PT, mental health, with the neurologist, with any specialist, with the pediatrician, with everything. We need to be involved in the care of our kids.
Yeah.
And
I was going to say, because parents are they may not be experts in ABA, but they're the experts in their particular child. And I think that point of like working as a team is really important to get like maximum benefit of the therapy.
Mm-hmm. And when the professionals are using terminology, like Dr. Miller said, if you are not familiar with that term, you are more than welcome to say to the professional, just give me 1 second, hold your horses right there. I don't know what you're talking about. Could you please explain that to me? And if you still don't understand, you can say, well, we're going to hold on that because I need to educate myself and ask until I can understand what that means. Then I will get back at you with, with the decision if we're going to use this or not. Yes. And that's perfectly fine.
Yep. And we're required, at least for behavior analysis, to, when we're talking to parents, explain in terms they can understand. And we are supposed to have informed consent. We can't get informed consent if the parent doesn't understand what we're presenting to them. So it's really on the behavior analyst to present everything in a way that the parent understands what's going on.
Correct. And Dr. Miller, so how can a family evaluate a provider's experience with autism?
First, I would definitely ask the provider for their resume, and that don't see this as a problem, right? It's okay. You should know what the background is of the person that's going to be spending so much time with your family. Ask them to explain their supervision and coursework specific to autism. Some programs really focus heavily on this and some don't. So it's not required in our field. In our field, we learn about behavior analysis and we work with different populations. So some people do not have a lot of experience with autism. I also would want to look at what their experience is with respecting neurodiversity. This is a newer concept in our field. And some providers are starting to use terms such as compassionate ABA or trauma-informed ABA or neurodiversity affirming ABA. I would ask the provider what training they have done to learn more about neurodiversity and what practices they engage in to create neurodiversity affirming interventions. It's important to keep in mind, this is an area that's just starting to grow in our field. So even the most committed providers, myself included, have a lot of learning to do. It also sometimes means people are using these buzzwords, but they're still engaging in practices that don't really take into account the perspective of the child and what is best for the child. If there's a lot of discussion about how to help the child fit in with norms and being typical, this is usually a sign that the provider, it doesn't have a whole lot of training in neurodiversity affirming practices. And that doesn't mean don't use them, but it's something you'll need to advocate probably a lot more for your child and really having child-centered practices with a provider that doesn't have that training yet.
And I was very happy when you mentioned that in the Spanish one. Because sometimes, I don't know if it happens to you, that we have parents or even other professional, like, here's the child, change the chip, fix him so he can sit when I say sit, stand, he stand, be quiet and speak, and and be like a robot. Or he can totally fit or make him normal. I have heard that. Make him normal. So no, he's a neurodiverse human being. He is a human being. Let's start with that. Then neurodiverse, and we need to know that child for who or she is, and and respect that individuality. We are
Mhm.
there to teach him some skills so he can be independent in the future, and reduce that struggle, and um, but it's not to change him to what I believe he needs to be and fit this box.
Yeah.
That's not what it is. That's not what we do. Neither ABA or mental health or any professional should do that. It's not about fixing anybody. It's about teaching
Yes.
skills.
So, you know, on that note, what does a good treatment plan look like? What is like good data collection reporting? I guess, a similar goes along with that. What does that all look like?
The treatment plans typically are going to vary based on insurance and funding source requirements because they have different providers require different things. But some key items that I would look for in a treatment plan or other documentation, I'll highlight some of those. So one is that there's a focus on individually assessing skill deficits that contribute to challenging behavior, such as emotional regulation skills, being able to cope with adversity in the environment. This is not something that we're typically trained on right now in our field. When you look at a lot of training that occurs on writing treatment plans, it focuses on identifying the function or why a behavior is occurring. And that looks at what happens after the behavior. Are they trying to get away from something? Are they trying to access something? Are they looking for attention? But it doesn't really focus on comprehensively assessing the skills that contribute to the why of the challenging behavior. So when I'm training people, I always focus on that needs to be the major part of your plan. This behavior doesn't just exist to access attention or escape. There's other things going on. And if we don't address those skill deficits, especially around emotional regulation, we're not going to make the best progress. It's not going to be the best plan for them. Another area that I would recommend trying to have in your treatment plan is a section that focuses on social communication, skill development from the perspective of the child and based on the child's motivation. Sometimes providers are trying to focus on skills that the child is not developmentally ready to learn yet, such as matching or doing different things with flashcards, being able to point to or label flashcards. Broad generic imitation programs like clapping their hands or touching their head, letters, colors, shapes, numbers. Those are all things that when the field first started, those were the main programs that people were being taught to implement. But research is showing the importance of developing a more connected relationship based on the child's preferences and promoting the use of social communication skills, such as joint attention, shared enjoyment, gestures. If the child isn't engaging in those skills yet, that should be the focus of the intervention first. And this is, I think, a big one for parents too, because a lot of times when parents think about their kids receiving therapy, they picture working on things like colors, shapes, letters, numbers, but it's the social communication skills that really make the difference. And then the last thing for the plan that I would also want to see is that there's a focus somewhere in the plan on really understanding the child and their strengths and preferences, because then that shows that the team is focused on connecting with the child and building programming around the strengths instead of just focusing on deficits. Data collection's a really big area that, again, it really varies depending on the funding source requirements and the individual needs of the child. At the very least, there should be a description of how data will be collected and analyzed. And more importantly, there should be evidence that the provider is actually doing that data analysis. Sometimes data is collected and it's clear after a few weeks or months that the child is not making the intended progress, but then no changes are made to the intervention. So I typically focus on taking data using what we call sampling methods, where I get to really interact well with my client. And then I note down a few data points about whatever we're working on. It's not what we call continuous data collection, but I'm able to pretty quickly see if they're making progress, and I can problem solve and tell if a procedure is not working. I can do that sometimes within a matter of minutes with some children, and sometimes it takes a little bit longer. many providers have to review a longer graph period of data collection to see what changes they're going to make. But either way, the key is they should be making changes if progress is not being made, and they should be digging into why, really trying to understand the reason that the child is not making the progress. It could be that there were other prerequisite skills that needed to be addressed first. There could be underlying learner skills that need to be developed, such as developing more attention to the task, or there could be a need to focus more on building motivation. There's a whole list of things it could be, and they should be trying to figure that out, not just collecting the data and letting it sit there as the child doesn't make progress.
And Dr. Miller, the RBTs are often the ones that are carrying out the day-to-day implementation of therapy. So how can families tell if an RBT is well trained and is being supervised and supported appropriately?
This is such an excellent question, and also another one that's difficult to answer quickly. But to me, the definition of well-trained varies. Some people would consider well-trained being that they've memorized all of the ABA terminology and they can follow the book learning that they've been taught. However, in my experience, this does not always translate to providing quality services. I prefer to observe how responsive the RBT is to the child in their moment-to-moment interactions. I would prefer to have a brand new RBT with very little training who can closely observe and be responsive to the child than an RBT who has years of experience and just blindly follows whatever protocols and procedures they've been trained in without considering the needs of the child in any specific moment. So I would encourage parents to look for RBTs who are genuinely trying to connect with their child and who seem to adjust what they're doing based on how the child is responding. And they can also explain why they're doing what they're doing when asked. Newer RBTs won't always be able to give that explanation. They might say, this is what my BCBA taught me, and that's okay. But over time, as they get to know the child, they should be able to give a brief explanation of why they're doing what they're doing. In terms of proper supervision for the RBT, you would definitely want to see that the RBT has direct interaction with the BCBA at least one time per month. Depending on how many hours the RBT is seeing the child, this might even be weekly if they're getting a lot of hours of therapy. And then during the supervision sessions, the BCBA should be talking to the RBT, answering any questions, modeling procedures, otherwise actively engaged. It should be a very active interaction. If the BCBA is on their phone or their computer, if they look really disconnected, it's highly likely that they're not providing effective supervision.
I think that's really interesting, your point about, the, I guess like the natural instinct of and responsiveness versus like the book learning, I guess. Yes. I know that with our experience with my younger brother in ABA, that my mom has often said that it wasn't necessarily like the ones that had like the most years of the RBTs that had the most, academic training that were the most effective or the best. It was often the ones who were really trying to like connect and get to know my brother first and kind of moving with him through the intervention. Is there anything else you would like to share with our audience? And I know we were asking very big general questions, but if there was any kind of other helpful information or anything else that people should keep in mind.
Yeah, I've just kind of summarized the things we've talked about in this coffee break. I think for ABA, we're similar to other professions. There's a range of experience and effectiveness, and this is especially true in Florida right now. I encourage parents to see their ABA provider as a team member and be open and curious when engaging with their ABA provider. Seek to understand what it is that they're doing and why they're doing it. If their answers do not align with your family values or you feel like they're not appropriate for your child, Be prepared to explain what you would like to see for your child and see if they are flexible in adjusting their practices. If they provide a reasonable explanation as to why they're suggesting the methods they are suggesting, and they explain how they will be supporting your child during the implementation of the plan, do a cost-benefit analysis for yourself to determine if this might be a less preferred route, but necessary to go down. Some providers do blindly implement certain procedures. They think they're practicing in the best interest of their client because they're rigidly following the teachings of our science. However, the best providers know how to put the child first and apply the science to support the child. And then I also have a list of some of my favorite resources for the parents that might be helpful in further understanding some of these suggestions.
Yeah, and I'll go ahead. Let me go ahead and start sharing some of those in our comment section for families. I am also going to include in the comment section it's a link to a 5-minute video tutorial that our colleagues at CARD FAU created on how to check for ABA provider certifications, because like you were, to your earlier point of Florida and the kind of lack of regulations, but this is kind of maybe another way to get a better sense of, if they have an active license, what kind of license they even had, and those kinds of things. So for those of you who are watching, if you, we do have a little bit of time. So if you have a question, please go ahead and also post those in the comment section. If you are viewing the show later on, please still put down your question, and we'll either try our best to answer it, or we'll forward the question to Dr. Miller to get a response. And then, if one of your comments kind of inspires an idea for a new episode in the future, we'll definitely make sure to give you credit on the air as well. So let me, just a couple more links to post. I know that one of the questions that we do frequently get, and I'm interested to hear your thoughts, are around trying to find an ABA provider when there is aggressive behavior. And I guess the providers not necessarily being comfortable with providing services. What would be kind of your advice for families in that situation?
It definitely would be helpful if we had some sort of specialization list or something, when we advertise our services. Unfortunately, I don't really see that happening. If they're in Florida, I've found a lot of the providers in any region of Florida, there's usually at least a few who have pretty extensive training on aggression and more intensive challenging behavior because of the universities we have in Florida, like Florida State and University of Florida, USF. Like, there are so many universities in Florida that have professors who focus like their lines of research in those areas. So that's a benefit. If they're outside of Florida, it does get to be a little bit trickier because there's not as concentrated university programs focusing on those things. What I've found in terms of looking, if you're looking at websites or you're contacting providers specifically around aggression, I would just ask about it up front. What is their policy for working with clients that are aggressive? How do they approach that? What is their crisis prevention training? If they don't have any, so we have some common ones that are used in our field. Safety care is a big one. There's one called PCMA. So there's different companies. Which company they use to develop their crisis prevention is not usually that big of a deal. But if they say, we don't have one, we're not trained in anything, that's not the provider you typically want working with your child if they have more intensive, challenging behavior. because that means they won't be able to train you how to be safe and engage in crisis prevention, and they won't be able to keep themselves safe either. The other part, though, that it's a little tricky, some of the most well-trained for safety purposes in dealing with aggression or more intensive challenging behavior, they also seem to take more of a stance where they don't see the person as a human. They don't see the child as a human, and they're over analyzing graphs and data, and like all options are on the table from a treatment plan standpoint, and the protocols may not be appropriate for the child. So they kind of, oh, the child's dangerous, so we can kind of do whatever we want with this, you know, and they really make a lot of excuses. So really finding a person who understands and, again, is more empathetic and wanting to connect and really learn about the child first, and then look at what's going on with the aggression. Usually people are going the other way around. They're trying to just hammer this aggression away, and they're not taking the time to really try to understand, where is this coming from? Why has it gotten to this point? What's going on in this person's life that this is what they have to do to exist and live? And thankfully, there's been some advancements in our field. There's a researcher out of New England. His name's Dr. Hanley, and he's developed what's called the practical functional assessment and skills-based treatment. They have, that's probably a link I should add, Olivia, maybe you could put it later, but they have on their website, they have a listing of providers who have been trained in their practices. That doesn't mean they have training in severe aggression necessarily, but they're more likely to approach things from a more humane standpoint than some of the other providers. So parents might want to look at that list and see in their area if there's any providers that have been trained in that particular procedure.
Okay. And I guess that from what you were just mentioning, that kind of echoes the idea of like looking at skills and what needs to be happening before like the actual looking at function of behavior.
Yep.
Okay. Let me double check to see if we have any other questions at the moment. Oh, I think, yeah, Yasmin, thank you. Just shared in the chat the link for that, the practicalfunctionalassessment.com. Yeah.
Yes, there's that one. And then I was trying to find specifically on their website. I don't see it jumping out at me, but their website where they list the providers. I'm going to put that in the chat here, and then you all can.
I'll go ahead and share.
Yeah.
So, all right. So I don't see any other questions over here at the moment. So, but again, if people do think of questions at a later point, please make sure to leave them there in the comments. So we're almost at the end of the show, but I didn't want us to leave without first saying thank you to Dr. Miller for bringing this very valuable information to our audience. This has been wonderful. Thank you. Okay. Quick question from Lisa. So her question was, is there help for autistic adults? I guess as far as using ABA practices.
Yes, there definitely is. It's not as prevalent that providers have training with adults. There are behavior analysts in every area that I've ever been that work with adults. And especially, I don't know, Lisa, if you're in Florida or not, but in Florida, there's a lot of folks who work with adults because behavior analysis in Florida has been around for so long. If you're in other areas, it might be more limited, but it's one of those things where you definitely want to find people that have experience with working with adults. One of my favorite behavior analysts who works with adults, his name is Dr. Shane Spiker, and he's in Florida. And there's, Broward County. There's definitely some providers in that area that work with adults. I know there's a company called teaching intervention. I think I'll find the link and I'll give it to you, Olivia, but there's definitely in Broward County, there's folks who work with adults there as well. Most of the time you're going to find that they are working with like MedWaiver is the funding source typically. And then of course, I think with CARD, most of the CARD locations have some resources as well, don't they, Olivia?
Yeah. So, I think Broward, you would be under the CARD out of the University of Miami, CARD UM. So they'd also be a good resource to reach out to ask about local ABA providers. And sometimes also I found with ABA providers is maybe they're, and this was more, again, with experience with my brother who just turned 32, but, they may have experience working with teens or maybe young adults, but they're able to modify what they know and kind of some of the programs to be more age appropriate for, an older adult. So there's that option as well. Okay. So yeah, we'll make sure to get that link over and post in the comments also if you want to check back, Lisa. So I also want to remind our audience that we are on the air every other week. So our next episode is going to be on October 20th, and we'll be speaking again with Dr. DeLeon Miller again regarding some of the challenges and criticisms of the ABA field. So please mark your calendars. You can't miss it. And that brings us to the end of the show. But before we go, I'll be posting another link for if you could please do us a small favor, just to complete a short survey. It's just 6 questions, so that we can to evaluate us and let us know if you find value in what we're doing, and helps us to kind of justify our time here on the air. And as always, please don't forget to give us a like, share this video on your page or with anyone else you think would find value. And to meet us here every other Friday at 10:45-ish, depending when we finish Cafecito, so we can share a cup of coffee with you as we spill the beans on important topics related to autism. So until then, we wish you good vibes and hot coffee. Bye, everyone. Happy Friday. Hope you have a great weekend.